Hi, we're going to talk about vitamin B12 today. Vitamin B12 is a water-soluble vitamin, and so like most water-soluble vitamins, vitamin B12 does not have a UL, but the recommended like daily intake is for males about 1.8 and for women between 1.8 and 2.8 depending on the life cycle. We need vitamin B12 for a lot of things. It helps to maintain nerve cells, but it also works to produce DNA and RNA and other genetic materials. Vitamin B12 works with vitamin B9, which we usually call folic acid or folate, to make blood cells and to help iron to do its job. It also works with folate or folic acid to create S-adenosine methionine, which affects our immune functions and our mood. And vitamin B12 also works with vitamin B6 and B9 to control the level of homocysteine in our blood. And so homocysteine is an indicator of heart disease. That hasn't been proven to cause heart disease, but if you have high levels of it in your blood, there's a pretty big chance that you have heart disease. We can get vitamin B12 only from animal sources, so fish, shellfish, dairy, organ meat, especially liver and kidney. Eggs, beef, and pork are all really good sources of vitamin B12, but sometimes you can get it in fortified foods. Vitamin B12 deficiency isn't very common, but symptoms of a vitamin B12 deficiency are fatigue, shortness of breath, diarrhea, nervousness, numbness, and tingling in your fingers or your toes. The elderly are the most likely to have a deficiency in vitamin B12 just because their diet is a little bit different, and they don't have as much stomach acid, which is what absorbs your vitamin B12. So since they have less and their diet becomes more restricted, they're more susceptible to a vitamin B12 deficiency. Vegans and vegetarians have a risk since they don't eat meat. People who have absorption problems due to an illness such as Crohn's disease, pancreatic disease, a weight loss surgery, or even medications that they might be taking that affect the way that they absorb will give them that risk. Helicobacter pylori is an organism that causes ulcers in your intestines, and so it damages your stomach cells that make intrinsic factor, which is used to absorb vitamin B12. So there we go with the absorption problems again. And then those who have an eating disorder, HIV, diabetes, or we already talked about the elderly. Like I said earlier, there is no UL for vitamin B12, but I did find that it's important to be cautious when you're taking supplements for vitamin B, because if you take a B vitamin for a long period of time, it can make an imbalance in your other B vitamins. So if you're taking a supplement for one B vitamin, you need to be supplementing all of your B vitamins. So your vitamin B6 can kind of screw up your vitamin B12. So just basically talk to your doctor, especially if you have like special health problems that affect your blood or anything. I found a study on Medical News Today about how when there's a vitamin B12 deficiency in pregnancy, there is an increased risk of the baby to develop diabetes. And this is because, in general, when someone has a low B12, they have a higher BMI. And so this leads to low birth weight of the baby with a high cholesterol in the baby as well. And so when they have that high cholesterol, they have a higher insulin resistance, and the babies have an increased risk for type 2 diabetes. But also they talked a lot about leptin, and when there's excess weight and increased leptin, or excessive weight increases leptin, and then when there's more leptin, your leptin resistance builds up, which will cause you to overeat because leptin is one of the things that helps you to slow down, which will cause weight gain, which causes insulin resistance and an increased risk of type 2 diabetes. The results of their study was that basically what it's been saying is that if a mom was deficient, then there was a higher than normal leptin for the baby, which increases the risk of type 2 diabetes and other metabolic disorders. But Dr. Adekala Antonisonil from the University of Warwick said that either B12 drives fat accumulation in the fetus, and this leads to increased leptin, or the low B12 actually causes chemical changes in the placental genes that produce leptin, making more of the hormone. And then he goes on to say that B12 is involved in methylation reactions in the body, which can affect whether genes are turned on or off. So they suspect that it is that's the cause. A cool thing that I kind of realized in doing this, as I was studying vitamin B12, I was really excited because meat is my favorite food group. And so I love that you can only get vitamin B12 from animal sources. But as I was looking in Moses, where they're talking about the creation, and in Moses 2:29 it talks about how we have everything that we need to sustain our life. We have been given so many plants and herbs and meat to eat. And in this verse 2:30, it talks about how it says, "And to every beast of the earth, and to every fowl of the air, and to everything that creepeth upon the earth, wherein I grant life, there shall be given every clean herb for meat." And it was so, even as I spake. And so, in reading that, like, Heavenly Father's just provided a way for everybody to have exactly what they need. But in Doctrine and Covenants, it says, "Yea, flesh, also the beasts of the fowls and the fowls of the airs, I, the Lord, have ordained for the use of man with thanksgiving. Nevertheless, they are to be used sparingly." And so, although we've been given animals to help us get the nutrients that we need, we don't need to overindulge just to get enough vitamin B12. So I liked that. So in conclusion, just keep animal products in your diet. It's the easiest way, but if you can't, there are supplements, but make sure you're taking all of your B vitamins together so that you don't make some kind of imbalance, because I also read that if you overdo it on your folic acid or your folate, vitamin B9, then it can mask the symptoms of a deficiency in vitamin B12, which can cause severe nerve damage because you can't tell that it's being messed up. That is all I have for you. Thank you.